Medical Dilemma.
Welcome back to Medical Dilemma. Before we resume our talk with Dr. Season, I'd like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation with its partner, Manila Workshops. Okay, now, before the commercial break, Dr. Season, we were talking about the tests that are conducted to confirm diabetes. You mentioned 3 tests. Now, do we have to do all 3 tests?
Sometimes you can do only 2 tests. As I said, you have to confirm. No?
2 tests.
For example, you want fasting blood sugar, and your first result is equal to or greater than 126.
Okay, so that's FBS.
Yes,
Okay.
and then you have to confirm with the same test.
The same
You can
test.
confirm with the same
with the
test.
same test.
Yeah. So if the next test is also over or equal to 126, then the patient's already confirmed
Confirm as
diabetes.
diabetic.
You only, for example, because some patients are referred to you, they do all the tests or 2 tests. No? So it sometimes happens that one test is meets the criteria for diabetes, and then the other one doesn't meet it. So what you do is repeat the test that is elevated.
Okay, now when does a doctor prescribe having all 3 tests, or at least 2
If
of those?
there is a high suspicion of diabetes, and yet the results keep coming out in between, like for example, because there is another state, no, there's another state we call as pre-diabetes.
Oh, pre-diabetes. Okay.
This is a group of people who do not meet the criteria for diagnosis of diabetes, but nevertheless, they have already abnormal sugar, because the normal blood sugar now is 99 milligrams per cent or below.
Okay.
But some people are over 99 or between 100 to 124 milligrams per cent. So they are not diagnosed diabetic, but they are not also normal. So they are lumped into a category of increased risk for
So
diabetes.
it's like a transition stage between being
but,
normal and having
yes,
diabetes.
but the beauty of this is that this stage is still reversible. No? So you can still become normal with if you undergo the proper steps like lifestyle, diet, exercise, and then relieve from stress, like that. So it is important that also this state or condition is recognized.
I see. So, in short, correct me if I'm wrong, diabetes comes from either there is lack of insulin, okay, or there is a resistance to
Yes.
insulin. Okay. Therefore, it doesn't mean that if you like to eat a lot of sugar, it automatically leads to diabetes. Is that right?
No, because well, you don't have you should not eat a lot of sugar, because it's laden with calories, and it will make you fat and
makes you
overweight.
fat.
And then, as I said, one of the predisposition for diabetes is being overweight or obese.
Okay. Now, you mentioned also that diabetes can have a genetic factor involved.
Yes.
Is there some genetic test that could be taken to see if a person has that predisposition?
Well, there are some genes that will carry the genes of diabetes, but usually we don't do that anymore.
Oh, you don't do that anymore.
But more so if we are going to diagnose for type 1 diabetes. Type 1 diabetes, usually they have genetics, and also now, especially now that there is a third classification of diabetes, which is called monogenic diabetes, other causes of diabetes, and they are usually really gene related. So that is the one that those are the type of diabetes that really needs confirmation by genetic testing. We have the neonatal diabetes and MODY, diabetes in the young.
Now, once a patient has been confirmed to be diabetic,
Yes.
what does a doctor now prescribe for the patient to do?
Well, the first thing, it depends on the status of the patient. No? So if the patient is not really symptomatic, no, or is not really in a decompensated state, no? So the first thing that we prescribe to the patient is a lifestyle change.
Lifestyle
no?
change.
So he has to lose weight if he's overweight. He has to exercise if he's sedentary, and then the doctor may or may not decide to start on medication. And usually the first medication that we prescribe is metformin.
I see. So it's not necessary to take medication immediately.
Yes, because if there are these factors that are present in the patient, and you think that it will be better that the patient changes his lifestyle first, then you can do it. No.
I see. And I suppose you only prescribe medication when the condition is very advanced.
No, you can prescribe
You can
medication
still-
at a certain level. No?
Still at a certain level.
For example, it's only slightly elevated. You have a 130, but you see that the patient is really overweight or not exercising or eating too much. You know. So then you can just
You can
tell the
prescribe
patient.
medication already.
No, you can ask the patient to change the lifestyle.
Change lifestyle first.
Because the trouble with giving medication right away is that the patient thinks that if he's taking medication, that it's all right not to change his lifestyle.
And continue with whatever
Yes,
he or she's
continue what
doing.
he's doing. Anyway, I have medicines. You have
see,
heard
I
about
see.
that,
Yeah.
no?
Okay. Now, what are the complications of diabetes? How does it, affect the lifestyle of a person?
Well, the complications of diabetes is due to its effect on the blood vessels.
The blood vessels.
Usually, there's destruction of the lining of the blood vessels, so you can either have what we call the microvascular, which affects the small blood vessels. And when we say small blood vessels, usually the ones affected are the eyes. So what we call the retinopathy, diabetes retinopathy. It can also affect the kidneys, no? So diabetic nephropathy, and it can also cause destruction of the nerves. So we have the diabetic neuropathy. And then it can also affect the big blood vessels. So we have the cardiovascular disease. So if it affects the blood vessels of the heart, so the patient will develop cardiovascular disease. No?
Okay.
And then if the patient blood vessels of the brain are affected, then cerebrovascular disease. And if the ones that are affected are the autonomic nervous system, then we have the autonomic
Now,
nervous
these
system.
conditions that you described, there are a lot of medical terms that were
Yeah.
mentioned. Are there physical signs that ordinary people can look for or watch out for to sort of warn them that you're suffering from something that's not good?
Well, it is better not to reach there symptomatic. No? So we advise that patients with diabetes should have, for example, if you're looking for the heart, they should have a yearly or exam
Annual
of
checkup.
the eyes.
Oh, the eyes.
Yeah,
Okay.
and then they can have also a checkup of the urine. Usually, we check the albumin in the urine
Okay.
because it is the first sign that the kidneys will be affected. And then, as to the nerves, you can do some microfeel. The patient really feels something. Sometimes they have numbness, tingling, like that. But
In the extremities.
yeah, and if they don't have that, then you can do some tests, no? Like microfilament test,
Yes.
the vibration test, no? And then as to the heart, then we can do ECG regularly
ECG.
or treadmill, no? And to the cardiovascular, usually we usually don't do routine ultrasound because it usually comes with symptoms, no?
I see. When should a person start having himself or herself checked for possible diabetes?
The American
there a
Diabetes
particular
Association
age?
recommends 45, age 45 and onwards for those patients who are high risk, no?
Okay, for those who are high risk.
Yeah, but
How do I
nowadays,
know if I'm high risk or not?
yeah, if you are overweight,
If I'm overweight?
yeah, you have a sedentary lifestyle. If your cholesterol is high, if you have hypertension, if your parents are diabetes, no, so
Okay,
maybe
so
you should
far-
start checking it, no,
So
checking.
far, my family does not have any
Yes.
signs of diabetes. So I'm probably good right now. I see.
But for some very high-risk patients, for example, they have signs of insulin resistance, like those who have what we call acanthosis nigricans. They have hyperpigmentation in the nape, or they are prone to infection, and then they can be checked earlier, because there are people who are less than 45 years old and they are already diabetic. In fact, there are also teenagers now who are already diabetic, type 2. Before when we say that people are young, usually their diabetes is type 1. But nowadays, there are young people who are type 2. And they are diabetic just because they are obese or
Just because they're
sedentary.
obese. How prevalent is it right now in the Philippines?
In the Philippines, according to the International Diabetes Federation, 2014, 3.2 million people Filipinos are now diabetic.
3.2
Million people. And that's a 14% prevalence. That is quite high. And also, there are 14% prevalence also of pre-diabetes.
Pre-diabetic.
So if we
14% as well.
don't act and we don't recognize those diabetes section, then the prevalence of diabetes will double. No? So it is
Really?
important.
So it's on an accelerated growth pattern.
Yes, and the growth is much higher in the Asia than the rest of the
Asia
world.
than in the rest of the world.
Because the overall prevalence of diabetes now in the world is 8.3%.
Wow,
But-
8.3% for the world, but
And now
14% for
the
us
Philippines.
in
Yes.
the Philippines. So I guess we really have to watch out for this disease.
And one thing more is that one of 8 people with pre-diabetes don't know that they have it,
1 out of 8 don't know
that they have
it.
pre-diabetes.
Pre-diabetes.
So I think it's good that those who are employed, usually they have a pre-employment, they have annual checkup.
An annual checkup.
So it's FBS is always included. So more or less
so
we
that
will see there
helps,
those
increase
are
awareness.
pre-diabetic.
I see.
Yes.
Now, are there any efforts from the government or from private institutions to increase awareness about this kind
Oh
of
yes. In fact, this month, July, has been proclaimed by the government as Diabetes Awareness Week.
Oh, this
So
month is
yes,
Diabetes
there are
Awareness
a
Month.
lot of activities that are being done by for example, the PSEM and all the other diabetes associations in the country, doing some activities to promote awareness. And the DOH also has its own program.
I see. And I suppose you will be part of some of these activities?
Oh, we have already in the diabetes center. We have our walk. No, we
Okay.
did our stepping out for
Stepping out,
diabetes last July 11. No, so we promote awareness, and we had a 1-week exhibit in our lobby. No,
At Makati Medical
yes,
Center.
at Makati Medical Center.
That's interesting.
Yeah.
All right. Thank you so much, Dr. Season, for that very informative discussion. Okay, we'll be right back after a few words from our sponsors. Don't leave this channel.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich, it could change